I cannot agree more with the physicians on our committee and the life that they've led, the lives you all have led, and how important you are. You're so important. I live in West Virginia, very, very rural state. You know, sometimes it can take from an hour to almost 5 hours, really, to get to your doctor or to your hospital because our terrain is just very challenging. But we need care. And, you know, just for a routine checkup, sometimes it's critical that our local rural physician practices exist so that they aren't always burdened, you know, with the far drive and the expensive visits to a hospital for something very minor. That's worried me for years, having to go to a hospital for something very minor when you could go to your family physician. Today's economic environment, with inflation through the roof and thanks to the reckless spending that continues to go on with this administration, many independent physician practices cannot afford to keep their doors open. Frankly, I think the federal government doesn't reimburse well enough to make it feasible for you to do it at all. So this is a huge issue for physicians as well as patients. Dr. Golson, I was really disheartened to hear about your struggles and your practice that you endured because of bad policy. And I know firsthand how devastating it is to rural communities to lose their local doctor. So to help paint the picture for my colleagues that may not be from rural areas, and there are a lot of them that aren't here that really ought to hear this, can you go into detail about the different physician-patient relationships that happen in independent practices, particularly in rural areas, compared to physicians in these huge practices?
So to paint the picture of how rural my community is, we are a one-stoplight town.
Yeah.
My patients would be able, they could walk to my practice to see me because we were right downtown. I was able to do home visits with my patients, which gave you incredible insight to what was going on in their life. I would see them at Walmart, and they would talk to me about their care. I would see them in church, and they would ask me questions about which specialist they felt like they needed to go to. And even though I closed my practice in 2022, I still get those questions from my former patients even today. So you really are a part of the community. You're part of the fabric. You sponsor the local baseball teams. You're at the team events as team physicians. The whole community becomes like family.
Well, you're almost the elder of the family, so to speak. I mean, you're just that important. As much as I'd love to see every independent practice thrive, I know that there are tons of challenges out there that you all face that can drive you to close or sell your practices and move into a larger health system. Prior to having to make the impossible choice to close your practice, can you tell us some of the pressures that come with competing for workforce with the larger health systems, or if there is any pressure to consolidate your practices?
So for me, competing with the local hospital was probably the biggest thing with my workforce. I could not compete with what they were able to pay my nursing staff. We already had a nursing shortage going into COVID, and COVID exacerbated the nursing shortage. A lot of nurses started doing travel nursing.
Yes.
And so it was just very difficult to compete. And the hospitals had an advantage because of the facility fees they were able to garner from the care that they were receiving. So that made it very difficult to compete.
You're right. Dr. Richardson, in order for people to understand more the business side of Medicare reimbursement, simply not being enough to even cover the costs of operating in a rural area, are there examples where Medicare regulations or reimbursement requirements have limited your practice's ability to provide high-quality services to your rural patients?
I think it's just more of, everything's more difficult when you're treating patients in rural areas. Unless you actually have a provider in that area, from a specialist standpoint, you're traveling. I mentioned earlier we have 13 clinics throughout the state. Those are clinics that we actually get in our car, grab our staff, grab our equipment, our scopes, our drugs. put them in our trunk, drive to that community to run a clinic, and sometimes do some simple outpatient surgeries at that local rural hospital, and then drive back. So it's just an increased burden. It's a burden to your quality of life. It's a burden to your practice at home. We have had the discussion of consolidating care and making patients drive to the Wichita metro area because we are so overburdened there. And we just haven't had the heart to do it because many of these patients simply cannot or would not make the travel. They don't have the social support or the resources to drive 3 to 4 hours. And honestly, I think one of the biggest improvements we've had over the last couple of years, one of the good things that came out of the pandemic was actually telemedicine. There are so many of these patients in rural Kansas that need a 5-minute appointment with me that could easily be done over telemedicine. And so we've tried to take advantage of that when possible.
Thank you for that answer, and I yield back.